If you didn't think that your skin can be affected by pregnancy, think again. As if pregnancy didn't already come with its own packages of aches and discomfort, there are a whole slew of skin conditions that are reserved just for pregnancy, and I think they deserve a little talk about. So let's jump into skin conditions during pregnancy. But first, my name is Diana. I'm a physician assistant and I specialize in women's health and gynecology. Thanks for watching Diana and the Peak, and if you're new here, we talk about women's health, pregnancy, and just being a mama. So make sure to subscribe if this sounds like your tribe. Okay, now let's jump into the video. We're gonna start off with common skin changes, and then we're gonna go over chronic skin conditions that pregnancy can make better or worse. And then we're gonna talk about skin conditions that are very specific just to pregnancy. Now, this last section has conditions that might need medical attention, so make sure that you watch this video till the very end because you're not gonna wanna miss that. So first, let's talk about some things that you can get anytime, but it definitely happens more often when you're pregnant. Spider veins. Spider veins are small veins that appear just under the surface of the skin. They can often appear on the face and in the arms, but most often they appear on the legs. Now, they're usually blue or purplish and have a web-like appearance, hence the name spider veins. Here's a picture of mine that I developed after my first pregnancy. When you're pregnant, your blood volume doubles by about 50%, which is a lot of extra pressure on your veins. And sometimes the little veins closest to the skin gives out and essentially relax and become bigger. You could try to prevent spider veins by wearing compression stockings. Exercise is a great prevention too, unless your OB has instructed you not to. After you've had your baby, if they are bothering you, you can have injections or laser treatments to help diminish them. Next is skin tags. Now, if you have never had a skin tag, consider yourself lucky. They are really common, but they happen more often when you are pregnant. Skin tags are small, soft skin colored growths that appear in so many places: the neck, the chest, the back, under your breasts, under your pregnant belly, basically any place where skin rubs together. And when your hormone levels are high during pregnancy, they tend to form more often. They're totally harmless. They don't change or develop into anything more dangerous, but sometimes there can be irritation if they form somewhere where your clothes or your underwear rubs on it, like under your bra or by your underwear. They might get better after you deliver, but they might not. And if they bother you, they can easily be removed either by cutting them off or freezing them or tying them off. Usually your medical provider will do that. Hi, sweetie. Oh, I love you. This is my little sickie. We're gonna hold her for a second. You guys don't mind, right? Mandy Moore recently talked about a skin condition that she developed during one of her pregnancies called melasma. Now, if you haven't heard of melasma, I'm sure you've seen it on someone. Melasma is simply darker patches of skin that can develop when you're pregnant. So these patches can form on your cheeks, on your forehead, your neck, and your arms, and they're caused, once again, by hormonal changes and increased melanin. Melanin is the natural pigment that's responsible for the coloration in your skin and your hair and then your eyes. And when you're pregnant and spend time in the sun, the UV radiation can bring on melasma. So prevention is 100% the best thing for you. Wear mineral-based sunscreens, wear wide-brimmed hats, or stay in the shade. Once you have melasma, it might fade after you deliver, but there are no guarantees. Again, which is why prevention is so important. But if you do develop melasma, there are topical creams like retinoids and hydroquinone to fade the dark patches, or there are chemical pills or laser treatments. Now, another common darkening women experience is a dark line that goes down our bellies. It's called linea nigra, which is Latin for black line. Often it goes from the belly button down to the pubic area, but sometimes it can extend from the belly button towards your sternum. Now, the reason why we develop it is similar to melasma. It's due to increased melanin, but unlike melasma, it usually fades away after pregnancy. Now, the skin condition that I, without a doubt, get asked about the most are stretch marks. Now, this can be really its own video, and in fact, I've actually done an entire video on stretch marks, and I'm gonna link to that at the end of this video, but in a nutshell, stretch marks are pink purplish lines that form over the belly, the thighs, the butt, and the breasts, and they form from rapid stretching of skin that happens when you're pregnant. But you know what? They can also form with things like puberty or with growth spurts. So when the skin stretches too fast, the collagen and the elastin, which support the skin, rupture, which leads to scarring that we know as stretch marks. Now, stretch marks can feel different than the rest of your skin, and it can be pretty itchy. As with other scars, stretch marks are mostly permanent, and prevention isn't always possible. There are lots of products that claim that they can prevent stretch marks, but the truth is, most of the time, whether or not you get stretch marks just has to do with genetics. So if your mom or your other relatives develop stretch marks, you will be more likely to as well. But other factors are your skin type, hormones, how much weight you gain during your pregnancy, and your cortisol level. There are a few products that have some weak evidence that they might possibly, for some people, help prevent stretch marks, and these are hyaluronic acid and Centella asiatica, and they may have some beneficial effects on skin elasticity and texture. Now, this video isn't sponsored by anybody, but I will link to them in the video description. As a side note, I want to emphasize that stretch marks are not something that you need to feel like you need to do anything for. They're beautiful, and they're like a badge of honor that you've done something amazing, which is, you know, make a human being. That being said, stretch marks do naturally fade from purplish red to a silvery whitish color, but if you do want to do something for your stretch marks, there are treatments such as laser therapy and prescription creams that may help improve their appearance, but they won't completely remove them. Moving on, there are a few chronic skin conditions that you have that can change when you become pregnant. For example, something called atopic dermatitis or acne, both can flare up when you're pregnant, and then a condition called psoriasis can either worsen or it can actually improve during pregnancy.
But wait, there's more.
Now let's spend some time talking about conditions that only occur during pregnancy. Interestingly, all of these conditions have one thing in common, and that is that they are all itchy. But the thing is, stretch marks are itchy, and then also just having dry skin can also be itchy. So how do you tell the difference? The answer is that each of the skin conditions have other features that helps your provider figure out what's going on. So let's start with something called PUPP rash. Not this kind of PUPP rash. PUPP is an acronym that stands for pruritic, urticarial, papules, and plaques of pregnancy. And like I already mentioned, it is itchy. But there's also a rash that goes along with it. It's a hive-like bumpy rash, most of the time on the belly, and then it can spread to other parts of your body like your legs and your breasts and your arms. The one place it doesn't usually affect is the belly button area. Once your medical provider diagnoses you, then they might recommend cold compresses, moisturizers, or possibly antihistamines or corticosteroids. Pemphigoid gestationis, which I'll call PG, is another itchy rash that can turn into blisters. Now, while I mentioned that the PUPP rash doesn't usually affect the belly button, this rash often starts around the belly button. PG is an autoimmune disorder, possibly related to the placenta, and once diagnosed, your medical provider might give you high-potency steroid creams or corticosteroids you take by mouth. Now, I'm gonna gloss over the next two because I really wanna take a minute to talk about the last condition, which, like I mentioned at the beginning of this video, needs medical attention. But there's prurigo of pregnancy and pruritic folliculitis of pregnancy. Both have itchy, rashy bumps, both can be treated with steroid creams, and in really severe cases, folliculitis of pregnancy may need to be treated with oral antibiotics. Finally, the last skin condition is the only one that is itchy, but has no rash. It's called intrahepatic cholestasis of pregnancy, or ICP. Often, itchiness is the only symptom, and it can get bad, especially the palms of your hands and the soles of your feet. ICP is caused by a problem in your liver. So normally, your liver makes bile acids, which are then released into your gallbladder and then released into your small intestines to digest fat and certain vitamins. But sometimes in pregnancy, the increased hormones slow the release of bile acids into the gallbladder, and the bile acids instead build up into the liver and then they spill over into the bloodstream. Now, bile acid in your intestines, great for digestion. Bile acids in your bloodstream, The primary medication used to treat cholestasis of pregnancy is a medication called UDCA. If the bile acids in your blood get really high, it can cross the placenta and negatively affect your baby, causing irregular heart rhythms, reduce blood flow to the uterus, or just be toxic to the baby, all of which are dangerous and can lead to stillbirths. So your OB will regularly monitor your liver and bile acids if there is any concern, and they may recommend early delivery. Now that is not every single rash that can happen during pregnancy, but those are the main ones that you're most likely to see. Make sure to have your OB or medical provider check out any rashes, symptoms that you're concerned about. This video isn't intended to diagnose you. That is only for your OB or your medical provider to do. But if you did like this video, I hope you give it a thumbs up. Also, make sure to subscribe to Diana in the Pink. Now, if you are new here, I've actually made an entire pregnancy series where I walk you through pregnancy week by week. I talk about baby development, symptoms you might be experiencing, what to expect at your OB appointment. So like literally everything that you need to know about pregnancy that week, that's what I talk about in that video. So I will link to that playlist right here. Click on that, go find the week that you are at. Maybe watch a few earlier ones just to catch up, but click on that and I will see you over there.